So now I'm going to talk about the norepinephrine, and as you know, because norepinephrine is the neurotransmitter in the adrenergic neuron, and it should theoretically stimulate all types of adrenergic receptor. However, when administered in therapeutic doses, the alpha adrenergic receptor is most affected. الأكشن للنورابinephrine include the cardiovascular action, where in this case include two types of action. First, vasoconstriction, where so norepinephrine causes a rise of peripheral resistance, وهذه تحصل due to intense vasoconstriction of most vascular beds including the kidney, واللي هو تكون alpha 1 effect, and also both systolic and diastolic blood pressure increase. The second action اللي هو البارو receptor reflex. So norepinephrine increases blood pressure, and in this case this stimulates the baroreceptors, including a rise in vagal activity, where an increase in vagal activity راح تؤدي إلى produce a reflex bradycardia اللي هي تكون which is sufficient to counteract the local action of norepinephrine on the heart. Although the reflex compensation does not affect the positive nootropic effect of the drug. Therapeutic uses norepinephrine so is used to treat shock because it increases the vascular resistance and therefore increases blood pressure. احنا اتكلمنا عن هذا الإفكت اللي هو يكون related بالcardiovascular action. In terms of the pharmacokinetics, so norepinephrine is given as IV for rapid onset of action. احنا اتكلمنا انه ال IV هذه طريقة الإعطاء offer a rapid onset of action. The duration of action is 1 to 2 minutes. It is rapidly metabolized by the MAO and COMT, where inactive metabolite are excreted in the urine. بالنسبة للأدفيرس effects تكون similar للأدفيرس effects are seen with the epinephrine. بالإضافة إلى ذلك norepinephrine is a potent vasoconstrictor and may cause blanching and sloughing of skin along uninjected vein. Where in case if extravasation occurs اللي هو leakage of drug from the vessel into tissue surrounding the injection site, so it can cause tissue necrosis. Impaired circulation from norepinephrine may be treated with the alpha receptor antagonist اللي هو الفنتولامين. والالترناتيف للفنتولامين include intradermal terbutaline and topical nitroglycerin. اوكي، هذه تستخدم بحالة impaired circulation occur نتيجة administration of norepinephrine. Another agent is the isoproterenol, واللي هو عبارة عن direct acting synthetic catecholamines that stimulate both beta 1 and beta 2 adrenergic receptors. اوكي، إذن هو عبارة عن direct acting synthetic catecholamine ويعمل stimulation for both beta 1 and beta 2 adrenergic receptors. its non-selectivity تعتبر as a disadvantage and the reason why it is rarely used therapeutically. Its action on alpha receptor is insignificant, where it produces intense stimulation of the heart اللي هو يكون beta 1 effect, where increased heart rate, contractility and cardiac output اللي هو يكون it is as active as epinephrine in this action. يعني من ناحية تأثيره على الهارت يكون الأكشن effective or active كما هو الحال عند استخدام الإبنفرين. also it dilates the arterioles of skeletal muscle اللي هي تكون beta 2 effect resulting in decreases peripheral resistance. يعني عندما يعمل dilation للarterioles of skeletal muscle this will result in decrease in peripheral resistance. And because of its cardiac stimulatory action, so it may increase systolic blood pressure slightly, but it greatly reduced main arterial and diastolic blood pressure. يعتبر potent bronchodilator, which is beta 2 effect, and the adverse effects of isobutanol are similar to the beta receptor related side effect of epinephrine. يعني يكون adverse effect similar للبيتا receptor related side effect of epinephrine. Okay. Dopamine is the immediate metabolic precursor of norepinephrine, where occurs naturally in the CNS in the basal ganglia, where it functions as neurotransmitters as well as in the adrenal medulla. الدوبامين can activate alpha and beta adrenergic receptor. So for example, إذا كانت at higher doses it causes vasoconstriction by activating alpha 1 receptor, whereas at lower doses it stimulates the beta 1 cardiac receptors. يعني بالنسبة للدوبامين has action or effect on both اللي هم الألفا and beta adrenergic receptor، وهذا يعتمد على الدوزز اللي يستخدم فيها. for example إذا كانت higher doses فراح يعمل vasoconstriction by activating alpha 1 receptors، بينما in case of lower doses it stimulated beta 1 cardiac receptors. In addition, D1 and D2 dopamine D1 and D2 dopaminergic receptors is distinct from the alpha and beta adrenergic receptors who occur in the peripheral mesenteric and renal vascular beds, where binding of dopamine produce vasodilation. Also, beta 2 receptors are also found in the presynaptic adrenergic neuron, where their activation interfere with norepinephrine release. يعني أيضا ال D2 dopamine receptor بتكون أيضا موجودة بالبريسينابتيك adrenergic neuron، واللي عندما يحصل لها activation this will interfere with the norepinephrine release. The action for dopamine, it has cardiovascular action, so dopamine exerts stimulatory effect on the beta 1 receptor of the heart, where have both positive inotropic and chronotropic effects, where at very high doses dopamine activates alpha 1 receptor on the vasculature resulting in vasoconstriction. احنا ذكرنا انه الالفا 1 activation of alpha 1 يكون related with vasoconstriction. هذا شنو هو عبارة عن تأثير الدوبامين على الكارديوفاسكولار، مثل ما تشوفون انه has a stimulatory effect on the beta 1 receptor of the heart، واللي يؤدي إلى both positive inotropic and chronotropic effects، وبال very high doses يكون also lead to activate alpha 1 receptor واللي resulting in vasoconstriction. It has action on the renal and visceral. So dopamine dilates renal and splanchnic arterioles by activating dopaminergic receptor اللي تكون موجودة، thereby increasing the blood flow to the kidney and other viscera. Okay, بما أنه راح يعمل على dilate the renal and splanchnic arterioles فإنه راح يؤدي إلى increasing blood flow to the kidney and other viscera. And these receptors are not affected by alpha or beta blocking drugs, and in the past low dose of renal dose of dopamine was often used in the prevention or treatment of acute renal failure. However, more recent data suggest there is limited clinical utility in the renal protective effect of dopamine. يعني كانت in the past used low dose or renal dose dopamine was often used بالprevention and the treatment of acute renal failure. لكن in more recent data suggest there is limited clinical utility in the renal protective effect of dopamine. Therapeutic uses, so dopamine can be used for cardiogenic and septic shock. It raises blood pressure by stimulating the beta-1 receptor on the heart to increase cardiac output, and alpha-1 receptor on blood vessels to increase total peripheral resistance. يعني هذا الأكشن يكون related to dopamine. It also enhances perfusion to the kidney and splanching area مثل ما تكلمنا قبل قليل, and increased blood flow to the kidney enhances the glomerular filtration rate and cause diuresis. والدوبامين is also used to treat hypotension, severe heart failure, and bradycardia unresponsive to other treatment. Adverse effects, so an overdose of dopamine produce the same effect as sympathetic stimulation. هذه اللي signs of overdose of dopamine راح تعطي same effects as sympathetic stimulation. والدوبامين is rapidly metabolized by MAO or COMT. والadverse effects include nausea, hypertension, and arrhythmias. Another agent هو الفينولديبام اللي هو عبارة عن agonist of peripheral dopamine D1 receptor used as rapid acting vasodilator to treat severe hypertension in hospitalized patients, acting on coronary arteries, kidney arterioles, and mesenteric arteries. It undergoes extensive first-pass metabolism and has 10-minute elimination half-life after IV infusion. ومن ضمن الادverse effects اللي caused with the administration of this agent is headache, flushing, dizziness, nausea, vomiting, and tachycardia اللي تحصل due to the vasodilation. هذه signs may occur with this agent. Another agent is the dobutamine واللي هو عبارة عن synthetic direct acting catecholamine primarily a beta-1 receptor agonist with minor beta-2 and alpha-1 effects. يعني هو يكون primarily beta-1 receptor agonist but also has minor beta-2 and alpha-1 effect. It increases heart rate and cardiac output with fewer vascular effects. يعني تشوفون إنه هذه الagents has effect on the cardiovascular system. It used to increase cardiac output in acute heart failure, as well as for inotropic support after cardiac surgery. It should be used with caution in arterial fibrillation because it increases the arterioventricular conduction. بالنسبة للأدفيرس effects تكون similar to epinephrine tolerance may develop with prolonged use of this agent. Another agent is the oxymetazoline واللي هو عبارة عن direct acting synthetic adrenergic agonist. هذه يعني كلها الكومباوند تكون related لل direct acting agonist, adrenergic agonist. So this is a direct acting synthetic adrenergic agonist ويعمل stimulation for both alpha 1 and alpha 2 adrenergic receptors. This agent is found in many over-the-counter nasal spray decongestants وأيضا يكون موجود بالophthalmic drops and used for the relief of redness of the eye associated with the swimming, colds and contact lenses. وit directly stimulates alpha receptor اللي تكون موجودة بالblood vessels supplying the nasal mucosa and conjunctiva, thereby producing vasoconstriction and decreasing congestion. اوكي، اذا هذا الايجنت يكون عادة موجود بالنازل سبراي decongestant، وموجود ايضا بالاوثالميك دروبس، ويكون has action or stimulate both alpha 1 and alpha 2 adrenergic receptors. وانه السبب اضافته لهذه الايجنت لانه يعمل stimulate للالفا receptors اللي بالبلود فيزلز اللي تكون supplying the nasal mucosa and conjunctiva. In this case producing vasoconstriction and decreasing the congestion. لذلك تتم إضافته إلى هذه agents. It is absorbed in the systemic circulation regardless of the route of administration and may produce nervousness, headache and trouble sleeping. وممكن أن يحصل local irritation and sneezing with the intranasal administration. Okay. والاستخدام use for greater than 3 days is not recommended لأنه ممكن أن يحصل rebound congestion and dependence with the administration of this agent. Phenylphrine is a direct-acting synthetic adrenergic drug which binds primarily to alpha-1 receptor. إذن الفينيلفرين هو عبارة أيضا عن direct-acting synthetic adrenergic drug واللي يرتبط with alpha-1 receptor. It is a vasoconstrictor that raises both systolic and diastolic blood pressure. It has no effect on the heart itself, but rather induces reflex bradycardia when given parenterally, making it useful for the treatment of paroxysmal supraventricular tachycardia, واللي هي عبارة عن a type of abnormal heart rhythm. It is used to treat hypotension in hospitalized or surgical patients, especially those with a rapid heart rate, where large doses can cause hypertensive headache and cardiac irregularities. وبالنسبة للفينيلفرين act as a nasal decongestant as well when applied topically or taken orally. It is also used in ophthalmic solution for mydriasis. Okay, إذن هذه هي عبارة عن therapeutic or clinical uses للفينيلفرين. Another agent is the midodrine اللي هو عبارة عن prodrug is metabolized to the pharmacologically active dicyclomidorine ويكون selective alpha-1 agonist act in the periphery to increase arterial and venous tone indicated for the treatment of orthostatic hypotension. وأيضا the drug should be given 3 times daily with doses at 3 or 4 hours intervals. So these information which are related to this agent. Clonidine is an alpha-2 agonist used for the treatment of hypertension. Where it also used to minimize symptoms of withdrawal from opiates, tobacco smoking and benzodiazepines. يعني إنه يستخدم حتى يقلل symptom of withdrawal اللي تكون related with opioid or tobacco smoking and benzodiazepines. both clonidine and the alpha-2 agonist guanfacine may be used in the management of attention defects hyperactivity disorder. يعني هاي عندما نعطي combination both of clonidine والalpha 2 agonist اللي هو الguanfacine In this case, they are used in the management of attention defects hyperactivity disorder, where it acts centrally on the presynaptic alpha-2 receptor to produce inhibition of sympathetic vasomotor center, decreasing sympathetic outflow to the periphery. A common side effect of clonidine lethargy, sedation, constipation, xerostomia, where abrupt discontinuation must be avoided to prevent the rebound hypertension. Another agents include albuterol and other agents, as you can see in the slides, and these are classified as short-acting beta-2 agonists, which used primarily as a bronchodilator and administered by metered dose inhaler. اوكي اذا هذه الايجنت هي تصنف او تعتبر كشورت اكتنج بيتا 2 اجونست، وانه تستخدم كبرونكودايليتر وتعطى عن طريق الميتر دوز انهيلر. بالنسبة للبيوتيرول احنا ذكرنا انه عبارة عن short acting beta 2 agonist of choice for the management of acute asthma symptoms، لأنه يكون more selective for beta 2 receptor than meta proterenol. والinhaled terbutaline عادة is not longer available in the United States، لكن إنه still used in other countries. Injectable terbutaline يستخدم off label as uterine relaxant to suppress the premature labor, and use for this indication should not exceed 72 hours. Most common side effects اللي تكون related with these agents include tremor, but patients tend to develop tolerance to this effects. While other side effects تكون restlessness, apprehension and anxiety. When these drugs are administered orally, they may cause tachycardia or arrhythmia، وهذا الإفكت يحصل due to beta 1 receptor activation, especially in patients with underlying cardiac diseases. والمونوامين اوكسيديز inhibitors الدراكس اللي تعمل inhibition للإنزيم اللي هو المونوامين اوكسيديز also increase the risk of adverse cardiovascular effect, and concomitant use should be avoided. اوكي يعني هنالك يحصل drug interaction ويا الدراكس اللي تعتبر inhibitor للمونوامين اوكسيديز، وهذه راح تؤدي increase the risk of adverse cardiovascular effect، ولذلك concomitant use should be avoided in this situation. Another agents which are the salmeterol and other agents واللي هي تعتبر as you can see in this slide واللي هي تعتبر or are long acting beta 2 selective agonist were used for the management of respiratory disorder such as asthma and chronic obstructive pulmonary diseases. إذن هذه الagents هي تعتبر long acting beta 2 selective agonist وتستخدم للمانجمنت of respiratory disorder اللي مثال عليها الأسما والchronic obstructive pulmonary diseases، single dose by meter dose inhalation device such as dry powder inhaler provides sustained bronchodilation over 12 hours، يعني لذلك هذه تستخدم in case of asthma or chronic obstructive pulmonary diseases. وهذه الagents تكون not recommended as monotherapy for the treatment of asthma because they have been shown to increase the risk of asthma-related deaths. However, these agents are highly efficacious when combined with an asthma controller medication such as inhaled corticosteroids. Okay, إذن هذه agents تكون not recommended للاستخدام as monotherapy لأنه بحالة treatment of asthma، لأنه ممكن أن تؤدي إلى increase the risk of asthma related deaths لكن تعطى as combined with asthma controller medication اللي هو مثال عليها الكورتيكوستيرويدز، يعني تعطى in combination with these agents. بالنسبة للميرابيجرون هو عبارة عن بيتا 3 agonist that relax the detrusor smooth muscle and increase bladder capacity، ويستخدم بالبيشنت اللي has overactive bladder، و it may increase blood pressure and should not be used in patient with uncontrolled hypertension، و increase the level of digoxin and inhibits the cytochrome P2D6 isoenzyme, which may enhance the effect of other medication metabolized by this pathway. Okay، يعني ممكن إنه يحصل interaction or there is effects for the administration of these agents with the drug. Okay, so now I finished the information which are related with direct acting adrenergic agonist, and now I'm going to move on to indirect acting adrenergic agonist. واللي اتكلمنا انه ال indirect acting adrenergic agonist هي cause the release or inhibit the reuptake or inhibit the degradation of epinephrine or norepinephrine، لذلك هي تعتبر indirect acting adrenergic agonist. مثال عليها هو الأمفيتامين، والأمفيتامين the marked central stimulatory action of amphetamine is often mistaken by the drug abuser as its only action. However, the drug can also increase blood pressure significantly by alpha-1 agonist action on the vasculature as well as beta-1 stimulatory effect on the heart. Okay، يعني إنه الأمفيتامين مثل ما أكيد يعني إنه سامعين إنه has or mistaken by drug abuser as its only action، لكن هذا الدراج also increase blood pressure بواسطة significantly by alpha-1 agonist action on the vasculature والbeta-1 stimulatory effect on the heart. إنه الأمفيتامين its action are mediated primarily through an increase in non-vascular release of catecholamine such as dopamine and norepinephrine from nerve terminals. Okay، يعني إنه through an increase in non-vascular release of catecholamine such as dopamine and norepinephrine from the nerve terminals. Thus amphetamine is an indirect acting adrenergic drug. The actions and the therapeutic use of amphetamine and its derivatives are discussed with the CNS stimulant يعني بالمراحل القادمة. Another agent is the tyramine، والtyramine is not a clinically useful drug، لكن يكون it is important because it is found in fermented foods such as cheese، وأنه هو عبارة عن it is a normal byproduct of tyrosine metabolism، ويحصل له oxidized by the MAO in the gastrointestinal tract. لكن if the patient is taking drugs اللي تعمل inhibitor للمونوأمين أوكسيديز، هذه الدراكس اللي تكون هي عبارة عن MAO inhibitors، فإنه it can precipitate serious vasopressor episodes. It is like the amphetamine, so it can enter the nerve terminal and displace stored norepinephrine, where the released catecholamine then act on adrenoceptors. لأن هذه الagents مثل ما ذكرت إنه تعتبر indirect acting adrenergic agonist. Another example is the cocaine, واللي هو عبارة عن unique among local anesthetics in having the ability to block the sodium chloride dependent norepinephrine transporter required for cellular uptake of norepinephrine into the adrenergic neuron. يعني يكون الأكشن هذا الكومباوند بأنه has the ability to block the sodium chloride dependent norepinephrine transporter واللي يكون required for the cellular uptake of norepinephrine. Consequently, norepinephrine accumulates in the synaptic space, resulting in enhanced sympathetic activity and potentiate the activation of epinephrine and norepinephrine. Okay, إذن بالنسبة للكوكاين has the ability to block the sodium chloride dependent norepinephrine transporter وهذا يكون required for cellular uptake of norepinephrine. لذلك عند غلق الصوديوم كلورايد dependent norepinephrine transporter راح تؤدي إلى accumulation of norepinephrine in the synaptic space وبعدها بالنتيجة راح يؤدي إلى enhance the sympathetic activity potentiate the action of epinephrine and norepinephrine. لذلك هذه أيضا تعتبر agonist لكن شنو تكون indirect agonist. The duration of action of epinephrine and norepinephrine is increased يعني بهذه situation like amphetamines it can increase blood pressure by alpha 1 agonist action and beta stimulatory effects. بالنسبة للmixed action adrenergic agonists example عليها اللي هي الإفدرين and pseudoephedrine واللي هي عبارة عن mixed action adrenergic agents. They not only enhance the release of stored norepinephrine from nerve ending but also directly stimulate both alpha and beta receptors. يعني هذه هي تعمل على enhance the release of stored norepinephrine from nerve ending لكن not only enhance the release of stored norepinephrine from nerve ending but also directly stimulate both alpha and beta receptor. These agents are not catecholamines and are poor substrate for the COMT and MAO. Therefore, these drugs have a long duration of action لأنه هي تكون not substrate لهذه الإنزيمز اللي هي تعمل degradation للcatecholamines. They have excellent absorption after oral administration and penetrate the CNS, but pseudoephedrine has fewer CNS effects. بالنسبة للإفدرين is eliminated largely unchanged in urine بينما الpseudoephedrine undergoes incomplete hepatic metabolism before elimination in urine. Ephedrine raises systolic and diastolic blood pressure by vasoconstriction and cardiac stimulation, and it is indicated in anesthesia-induced hypotension, where ephedrine also produces bronchodilation, but it is less potent and slower acting than epinephrine or isoproterenol. Okay, then also it has a bronchodilator effects لكن يكون less potent and slower acting عندما نعمل comparison with the epinephrine or the isoproterenol. Previously it used to prevent asthma attack but has been replaced by more effective medications where ephedrine produce mild stimulation of the CNS, and this increases the alertness and decrease fatigue and prevents sleep. يعني هذا نتيجة أنه يعمل mild stimulation للCNS as a result it increases the alertness and decreases fatigue and prevents sleep. It also improves athletic performance, where the clinical use of ephedrine is declining because of the availability of better or more potent agents that cause fewer adverse effects. Oral pseudoephedrine is primarily used to treat nasal and sinus congestion, and it has been illegally used to produce methamphetamine. لذلك هذه البرودكتس containing pseudoephedrine have certain restriction and must be kept behind the sales counter in the United States. بما أنه يدخل أنه يستخدمونه بصورة illegally to produce الميثامفيتامين اللي هو يعتبر أحد drugs of abuse. لذلك produce or product containing pseudoephedrine تكون هذه عادة يعني sale under restriction and must be kept behind the sale counter in the United States. So this figure shows some adverse effects observed with adrenergic agonists in general, واللي هي تكون for example arrhythmias, headache, hyperactivity, insomnia, nausea and tremors. هذه اللي هي عبارة عن some of adverse effects which are observed with adrenergic agonists. Okay, this figure shows a summary of the therapeutic uses of adrenergic agonists, واللي هي تشمل مثل ما ذكرت اللي direct acting adrenergic agonist, direct acting adrenergic agonist والindirect acting adrenergic agonist و mixed action adrenergic agonist. احنا تكلمنا عنها لكن بهذا الفيجر هو عبارة عن summary للtherapeutic uses لهذه الagent. So in this figure you can see the drugs, the classification of drugs or different categories of agents. For example مثلا الابنفرين والreceptor specificity therapeutic uses for each agent. So you need to read and understand the information which are represented in this figure, because it will be very helpful for you to understand the information which are represented in the slides. Okay, this is the end of the lecture. For today. Thank you very much for your listening, and if you have a question or need for any clarification, please feel free to ask.